There we go. Great. Thank you. So we are talking about coping with cancer emotions, which is, I know the emotional side of a cancer diagnosis is something that comes up in our conversations with our participants. I know from my own experience, it comes up so much. And a lot of times we don't know how to cope with that diagnosis or how to help our caregivers cope with it. And we have a wonderful expert joining us this evening that will go through why is it so emotional, giving us some tips to start that conversation, validating some of those feelings that we're having, which I think is something that we all need. So we've got really great discussion for this evening that's going to take place during our Hangout. As you can tell, we are recording, so this episode will live on our Her Library. So if you have to hop off early, or if you know someone that may benefit from listening, if you want to come back and watch this maybe with a significant other or a partner, someone that would benefit from kind of hearing a little bit about this discussion, you're welcome to come back and view it. So that'll likely be on by the end of this week. Just a couple of housekeeping. So we do ask those to just keep yourself muted as we move through our Hangout. You are welcome to type in the chat if you have questions, if you have comments, suggestions as we move through the discussion. Use that chat. Even if you just want to say hello to those that hopped on and let us know where you are hanging out from. We'd love to see where our participants are from. I'm in Philadelphia today, this beautiful day today. So we're so happy to have you. I will be also monitoring the chat. I love this. I'll be monitoring the chat, so I will be chiming in with Cynthia if questions come up, calling out some things. Anyone that wants to, again, raise their hand and verbally answer a question. We might have a little bit of a smaller group, which makes for really lovely conversation. So we love that. And then on top of that, I just want to give a quick thanks because, as you know, we do these virtual education series every month, several times a month. So our virtual Hangouts, we could not continue to bring you experts like Cynthia, topics like coping with with emotions with a cancer diagnosis. We couldn't continue to have these topics without the benefit of our supporting sponsors. So I want to give a big thanks to West Pharmaceutical and then their supporting sponsor, which is Daiichi-Sanyko, Merck, and Seagen, for continuing to support us and topics that are important to our participants. And if there is something that is really important to you that you'd like to do a little bit of learning, we are always open to discussion. We are always open to ideas. So please feel free to, email us, reach out, put in the chat, message me privately if there anything comes top of mind. So with that being said, I want to welcome you. So let's kick off our virtual Hangout for November. We are going to start off with something warm. I thought this was really great because I thought it would be warm and comforting to get us to start opening up about our emotions, right? So let's kind of get into that comfort. Let's kind of get settled in as we continue to have this dialogue together. So I am making a hot toddy. I love it. I'm making a mocktail hot toddy, which is so easy. I love this kind of beverage. And I have my little, over here, I have my favorite little mocktail cookbook. I was sharing this before we went live tonight. So at Unite for Her, we're always whipping up mocktails. And if you're looking for inspiration for something that is without the alcohol, but is still fancy and delicious and special, there's got really great recipes in there. So I totally recommend it. I bought it on Amazon for super cheap, but this is where I'm getting that recipe from. So let's make a really quick hot toddy. It's super, super simple. The only things that we will be needing is some tea. I've got some fresh lemon and I have some honey here. So the ingredients can really be versatile depending on what you have and what you like, but lemon certainly is the key, and your favorite mug. So you can use whatever you have. So the first thing that we're going to do is steep our tea. So I do have some warm water here. So let's talk about the type of tea that we want to be using. I'm just going to steep this while I chat. So for something like this, we do want to be using or normally we would reach for some sort of black tea because it's really conducive to the flavors. There are lots of different black teas, some that have a little bit of a smoky flavor. I'll just show you the type of black tea that I'm using. I really like it because it has a little bit of that orange undertone to it. But whatever kind of black tea you like and you prefer, you could in theory start with. One thing to note about our black teas is that they do have caffeine. So, I might be pushing the envelope a little bit and having caffeine at 5 p.m. I will check back with everyone later. So if you are sensitive to caffeine, or it is something that you're enjoying in the evening, you can swap it out with something else. That's absolutely fine. And again, flavor and versatility of our tea is really what makes this creative. So I'm going to let that steep for just a little while. And then before we put together our ingredients, I will take my tea bag out. The next thing that we're going to do is add some lemon to this. So I have a full lemon, and I will be juicing this. So for an 8-ounce serving of tea, you're looking for about 2 ounces of fresh lemon juice. It's probably about half of a lemon. Unless it's really dry, you might want to juice the whole thing. But this one is a pretty juicy. So I'm going to use this whole half lemon. The other half I'll use as a garnish, which I really love. So we'll get that mixed a little bit. I think the lemon with the orange, it's going to be really lovely. And then I'm adding a spoonful of honey. So this is also where it gets really, really versatile. So I'm using a buckwheat honey. I actually prefer this type of honey this type of year because you get a little bit more of an earthier flavor from this honey. You can see the dark color is very characteristic. When bees are pollinating from the buckwheat plant, it tends to create this much darker honey, and it just is really conducive to that beautiful, deeper flavor. I have my little honey stick here. And the recipe calls for, about a tablespoon. If you like it a little bit sweeter, you can certainly add a little bit more. But again, you can really be creative in terms of what your overall preference is. So I'll let that steep a little bit and set that aside. It's already smelling really lovely. Okay. Once we're finished and this is steeped, I will remove my tea bag. Sometimes I am the type that leaves it in for way too long. Oops. And then we're going to garnish. So I'm going to add a little slice of lemon just to let this sort of float in my mocktail hot toddy. And then once we have this assembled, that's really it. We'll give this one quick stir. Now, for most of our mocktails, you know that I always say, this is the time to pull out that special glass, right? The fancy glass, whatever you might otherwise have as a fancy beverage, this is also the time. It's important to note with hot beverages, you want to make sure that, usually we're seeing a hot toddy in something like a clear glass. You just want to make sure that it is heat proof so that it doesn't crack. Or again, you can use your favorite mug. I love this Unite for Her mug because it has a wide top. So for me, this really speaks comfort. So, oh my gosh, that's good. Ooh, that is wonderful. Really bright with the lemon, little undertone and warm of the orange. So I really love this. So I will continue to sip on this. Hopefully you are gathering your favorite warm cup of tea. Maybe you have these ingredients in hand. And once we kind of dive in with Cynthia, you can make your own and enjoy as we kind of gather and conversate together. So that is our hot toddy mocktail to get us started for our evening. With that being said, I want to now move into our main event as we're sipping and enjoying. So tonight, as you know, our topic is coping with cancer emotions. Thank you. And we have a wonderful guest with us, Cynthia Hayes, who I think we are all going to learn so much about. So Cynthia, we are so excited. I want to give a brief introduction about Cynthia because her experience is wide, and she has worked a lot with the cancer community and in particular emotional health and addressing emotional health. And she's got really great resources. Just to share a little bit about Cynthia, she is, pardon me, a cancer survivor, a patient advocate, a peer mentor, a speaker, and the author of an incredible book, The Big Ordeal: Understanding and Managing the Psychological Turmoil of Cancer. She is dedicated to supporting patients through the emotional experience of cancer And she founded thebigordeal.com, which I would highly recommend checking out her website. It is filled with a ton of great information. It is, in fact, a resource for patients and caregivers. Thank you. You see that book, and I will be linking that in our chat for those that want to hop on once we wrap up. But it is a resource not only for patients, but for caregivers, coping with cancer emotions, how to speak passionately on the topic to different patients, how patients can speak with their caregivers through the entire cancer process, and offering support organizations that can help all of us. So Cynthia is truly an expert in this field, and we are so thankful to have her here with us. So Cynthia, welcome.
Thank you so much. It's a pleasure to be here. And I just want to reiterate that I'm a survivor. I had endometrial cancer, and like all of us, the diagnosis comes out of the blue and just shakes up your world. But I'm not an oncologist and I'm not a psychotherapist. And so I want to make that perfectly clear, because if I say anything that you have questions about or whatever, you might want to discuss it with your doctor. That said, I really feel like I have been preparing my whole life to write this book, because what I have done first as a journalist and then as a management consultant and, sorry, Mom, as a kid for decades, was ask questions. And what I'm really good at is asking a lot of questions, synthesizing information, and then trying to tell a good story. And I hope that that's what I have done in the book, and I hope that that's what I can do for you today. And of course, the first question everybody always asks me is, well, why did you bother to write this book? Why, there are so many cancer books out there. Why write another book? And, I was really surprised through my own cancer experience at how emotional I was, and that sense of isolation, that nobody could possibly understand what I'm going through. And yet the complete lack of conversation by my medical team and by others around me about the emotional experience. So it wasn't until after the fact, really, I was late in my treatment, bald as can be, weak, pathetic looking, at the gym, trying desperately to make the pedals on a stationary bike go around. And some guy comes and sits next to me and starts telling me his cancer story. I mean, I didn't invite him to do that, and I didn't tell him that I had cancer. It was pretty obvious. But as he was talking, it became clearer and clearer to me that there's a great deal of commonality to the emotional experience that we all go through with cancer. And I wanted to understand that. So I ended up speaking with hundreds of cancer patients and all sorts of experts to try and understand, why is cancer so emotional? And therefore, what can we do about it? And what I learned is that, in fact, cancer is emotional for a bunch of reasons that have to do with sort of what's going on inside our bodies and our brains, as well as a bunch of things that are going on in the world around us. Inside our bodies and brains, though, I mean, let's start right there. There's so many changes that happen as a result of having cancer and as a result of the treatments that we all undergo, whether it's chemotherapy, radiation, immunotherapy. All of these therapies and the presence of the tumor itself cause changes to our body at the cellular level that ultimately get translated into brain chemistry changes that influence the way we respond to cancer and make us much more volatile, much more likely to be depressed and emotionally different than we were before the diagnosis. I learned that there's a class of proteins in our bodies called cytokines, and you might have heard of them in the course of COVID dialogue lately, because they are a part of, or the cytokine storm can be part of the COVID experience. But cytokines are proteins that allow the immune system to communicate with itself. And so there are a bunch of pro-inflammatory cytokines and anti-inflammatory cytokines, and they're supposed to stay in balance. But if you get a paper cut, the pro-inflammatory cytokines get released into your blood system and say, hey, there's an open wound here. Let's bring some platelets here to close up that wound. Let's bring some white blood cells here to make sure that there's no infection. Let's bring some red blood cells here to, because we've been bleeding a lot. And all of that activity goes on. And then, and you'll see your finger gets a little swollen, or if you have an infection somewhere, it gets a little red and swollen. That's cytokine activity or pro-inflammatory cytokine activity. And then when things are, in theory, all better, the anti-inflammatory cytokines come along and reduce that swelling, tell the platelets, okay, stop, we've got enough. Tell the red blood cells, okay, all's calm now. But when we have cancer, that also causes a release in pro-inflammatory cytokines, just the presence of those cancer cells. So does surgery. I mean, think about it. If a paper cut is going to release some pro-inflammatory cytokines, what is major surgery going to do? And it turns out that chemotherapy is an inflammatory experience on the body. Radiation causes inflammation in the body. So all of these things cause a lot of inflammation in the body. And because we're undergoing this process for a period of months, those pro-inflammatory cytokines get a little out of control. And when they get out of control, as a neuroscientist explained to me, our brains read that as, oh my God, we are so sick, we better climb back into bed and pull the covers over our heads. And that's when the fatigue sets in, the depression, the sense of isolation, because those are protective mechanisms. Those are our body's way of saying, you're not going to be able to run away from that lion who might be chasing you across the prairie. So get back into bed and stay there. But, as we know, we don't get chased by lions very often anymore. So what we really need is to find a way to get on with our lives. And yet, it's hard to turn off that brain chemistry once it gets started. So we've got that going on the inside. And then, a lot of these therapies and treatments, particularly for women's cancers, involve immune suppression, hormone suppression, and or removal of our ovaries, or making our ovaries feel like they've been removed. And all of those hormonal changes can also wreak havoc with our emotions, as can the steroids that are a big part of a lot of treatments. I know for me, I got dexamethasone as part of each one of my chemotherapy treatments. And that would make me feel great for about 24, 48 hours. But nobody warned me about the emotional crash after the dexamethasone left my system. So we've got a lot of different chemical changes going on in our bodies that really cause a lot of emotional changes as well. But at the same time, we're undergoing a bunch of crazy things on, that are happening on the outside, like fear of death. Most of us grew up in the age where cancer was a death sentence. And the idea that you would get diagnosed with cancer meant that, of course, you were going to die because there was no cure. And that's less and less the case, but it's still a big part of what the media tells us about cancer. And it's been reinforced for generations that cancer equals death. So we've got that hanging over our heads. For many of us, there's a sense of responsibility that, I did something that caused my cancer. Oh, I had an abortion and therefore I got endometrial cancer, or I, smoked for a month in college and therefore I got breast cancer, or, I didn't eat a healthy enough diet, or I didn't exercise enough. All of these things that we bring to our assumption about why we got cancer, that can really weigh on us and increase our emotional volatility. Cancer still carries a stigma. Cancer and cancer emotions in general carry a stigma. Add to that the fact that we're being treated not by the doctor that we've known and loved for decades, but all of a sudden we've got a brand new care team. We don't have the rapport with them to be able to say, ooh, I'm not feeling so good inside. What's going on? And that makes it harder for us to talk about our emotions. And then there's just the whole uncertainty and complexity of the thing. I mean, if you think about it, from the time somebody first suggests, there's something funky going on in here, until you actually hear the words, yes, we can confirm you have cancer, until you actually know what the cancer is and what the plan is to get rid of the cancer. That can be weeks and sometimes months, depending upon how your care team goes about it. So we've got this extended period of stress and chaos in our lives at the same time that we've got all of these chemical changes in our bodies and in our brain. So of course, it's a little emotional. It can be a really crazy time. And of course, you know, we're interested in our emotions, not just because there's this expectation that we should stay positive and be strong, which only increases the burden on us, but we're interested in leveling our emotions a little bit, because our emotions can influence our physical health. If we're so depressed that we don't feel like we can get on with life, it's going to be pretty hard for us to get on with the next round of treatment. If we are feeling so fatigued that we can't deal with day-to-day life, it's going to be hard for us to maintain our work commitments or our household commitments, and therefore get on with what we need to do. So the interaction between our emotions and our physical health is really compelling and needs to be understood enough so that we're saying, yeah, treat me not just physically, but treat me emotionally as well. And it turns out that the patterns of emotions that we tend to experience can be pretty predictable. They follow pretty standard pattern from diagnosis to recovery or progression, but they can vary in intensity and can vary in sort of how we express them. And we're also different. We have different life histories before we hear the words, you've got cancer. We have different DNA. We have different cultural backgrounds and norms and a different set of assumptions going into our experience. That's all going to influence how we present our emotions. But that doesn't mean that we don't experience them. And of course, you know, sometimes our prognosis, our pain levels, the medication we're on, all of those things can influence treatment. But Erin, if you could bring up that slide, we can talk about sort of what the typical sequence of emotions is. So that roller coaster in the background, the orange wavy line represents fear, which is really at our highest when we first hear those words, you've got cancer. And the pink roller coaster is stress and anxiety, which unfortunately are constant companions throughout the cancer experience. But then as we go from diagnosis to either end of life or end of treatment and emotional recovery, there are a unique collection of emotions that tend to emerge at different times. And of course, you know, we're all a little bit different. So this isn't, you know, gee, I never experienced fatigue, there must be something wrong with me. It's rather, this is sort of a general sense of what is a common experience. And I want you to understand these so that you understand that you're not alone, that, you know, what you have experienced is somewhat typical, and that it's okay to feel these things, that they are an expected and acceptable part of the cancer experience. So at diagnosis, for most of us, the overwhelming sense is just shock and disbelief. I mean, how can this be happening? And often it's a why me? How is this happening to me? But definitely shock and disbelief. And of course, that's when our stress is so high. And the stress actually tends to increase until such time as we make a decision. Because during decision time, we are on information overload. We have just heard so much. And often, because we're stressed, our prefrontal cortex, the part of the brain that usually processes information and allows us to communicate, that prefrontal cortex sort of shuts down. And we don't hear a lot of what the doctor says. You know, often we hear the words, you've got cancer, and then not anything afterwards. because of that information overload. But often we find a period of sort of hyper efficiency where we know that we have to get everything done before we start treatment. We know we have to make a decision and choose a care team and decide when we're going to move forward and with whom. So it's a very active time. And then we start treatment, whatever that first initial treatment is. Sometimes we feel a sense of relief that, whoa, finally somebody is dealing with this cancer, and our fear begins to dip and our stress and anxiety begins to dip. But often this is when we feel isolation and tremendous chaos and loss of control. That, you know, okay, now I'm giving myself over to the cancer gods, and I don't know what's going to happen from here. I don't know if this treatment is going to work. I don't know if how I'm going to respond to this treatment, and I don't know if I'm going to be able to deal with what life is going to throw at me next. After we get over that initial response, as treatment goes on, this is when the fatigue tends to build, when the depression can come in, when we begin to get cognitive impairment or chemo brain. Chemo brain happens without the chemo, so radiation and surgery and even immunotherapies can cause chemo brain because it really has to do with the inflammatory response on the brain. And this is when, for many of us, we begin to have an identity crisis where we don't know who we are anymore. We don't know what we're going to be like if we come out the other side. And that loss of control can be really overwhelming, whether, you know, all you had control over was your own life, or whether you ran a household or ran an office or, you know, a team at work. All of a sudden now you feel like you can't even, you know, do anything other than run to the bathroom. And yet somehow you've got to figure out how to move forward. So that identity crisis and that sense of helplessness are very, very common. Throughout treatment and often long after treatment, we have testing and monitoring. And that's a time when, for many of us, stress and anxiety increase. You might hear people talk about scanxiety, where you don't know what's going to be revealed by that next test. And of course, whatever was going on in your body was going on, you know, 2 weeks before the test, and will be going on again, you know, 3 weeks after the test. But that few days leading up to the test and the few days waiting for the results, that's when our anxiety mood tends to peak. Now, many of us manage to skip over these next two phases, but if we're unfortunate enough to have a recurrence or a progression, two of the most common emotions then are anger and sadness. And the anger can be directed at everything from your care team to yourself, to your God, to your spouse and partner. It's just anger at a failure in the medical system to have cured your cancer, to have saved you from this fate. And it is so common. There is one patient I spoke with who is a minister, and he had a rare type of thyroid cancer, and he was told that that's it, cancer's cured, you're done, everything is fine, only to discover 6 months later that it was back. And when he heard that it was back, he said he spent the entire car ride home, a half hour in the car, screaming at God that this should be happening to him. So that anger is just there for many of us who recur or progress. If in fact you move towards end of life, the most common emotions experienced then are frustration and guilt, in the sense that, you know, how is it that this is what's happening to me? And of course, people have a tremendous sense of helplessness that, you know, they can't change this, and a loss of sense of purpose that all that they can do at this point is continue to get more treatment and slowly fade away, or accept that that nothing is going to make a difference. And so there's a tremendous, again, anger and denial, and eventually some acceptance to reality. And as you see, fear and stress and anxiety increase dramatically for those who experience a progression or transition towards end of life. if we're lucky enough to skip over those two phases and get to end of treatment, you would think we would be extraordinarily happy that treatment has ended. But for many patients, what they experience is an enormous sense of loss and confusion, and maybe an increase of fear and anxiety as well. Because for whatever that period of time has been that you've been under treatment, people have been watching you. They've been monitoring your health. They've been there with you every day and every week, and you're done with treatment, and your medical team sort of, dust their hands off, brushes you aside. Your care partners and friends, everybody is ready to move on. Oh, thank goodness, Cynthia's all done. But in fact, we're not all done. We're far from healed. We're nowhere near back to balanced hormones and brain chemistry. We don't have any strength because we've been, sitting on the couch for the past X number of months. And we certainly don't have the clarity of brain function that we had before we first heard those ominous words, "You've got cancer." So this is a period of tremendous loss and confusion. Eventually, we get to the point of physical recovery. And then after physical recovery, homeostasis and a rebalancing of all of our body chemistry and therefore our brain chemistry. And then we can get to emotional recovery, where we begin to accept that this is our new normal, and begin to, for many people at least, find some degree of benefit in the experience. What have I learned? Not that cancer is good, but what have I learned about myself from having been through this experience? And that helps us get on with life. So that's a typical course of emotions. And of course, that's a lot of emotions for anyone to experience in, sometimes a very compressed period of time. Sometimes it goes on for years, but that's a lot of different emotions to experience. And of course, once we understand that there are all of these emotions that we deal with, the next question is, well, what do I do about it? How do I cope with all of those emotions? And, I like to say that the only right way to cope is the one that works for you. We're all different, and what works for me might not work for you. And also what works at this moment, at this particular hour of this particular day, might not work tomorrow, might not work 3 hours from now. And so it's really helpful to have a whole toolbox of things that can help you cope. And there are really 3 different categories of coping mechanisms. There's mind-body coping, which, yoga and Tai Chi and meditation and singing in the choir and even knitting, things that have sort of a repetitive component to them and combine both a physical and a mental activity, can really reduce the stress hormones in our brain. For me, it was knitting. If you're saying knit one, purr one, knit one, purr one, you have to focus on that. And therefore you can't be focused on, oh my God, what if this happens? What if that happens? And so it just settles the brain. So that's mind-body coping. That's one set. But then there's each of those components. There are physical ways of coping and there are cognitive ways of coping. Physical ways of coping are things like exercising, getting a hug, petting the dog, eating a good, healthy, balanced diet. All of those things help change our body chemistry and therefore our brain chemistry. You might have heard of endorphins. That's a body chemical that gets released when you exercise or when you have a pleasurable experience. There's also oxytocin, which is a chemical that is released during and after childbirth. It's part of the bonding between a mother and child. It also gets released when you hug somebody that you love. And so hugging is a really important component of staying calm through treatment. So is laughter. It also changes our body chemistry and therefore our emotions. And then the third is coping by thinking. And that involves everything like problem solving and compartmentalizing and biting off, only, one day, one thing at a time. And in my case, at least asking a lot of questions. So as you can see, coping by thinking was my way of getting through. But it really helps to have some of each working for you because there are days when we feel like we can exercise, and there are days when we can't. There are days when you can find a funny movie to laugh at on Netflix, and there are days when nothing makes you laugh. And so it's good to know that you've got other things at your disposal. And I just want to give a special plug for exercise as a part of coping, because it not only helps you feel better, but they've also shown that it can help speed your recovery. It can help reduce recurrence of cancer, and it can manage a lot of side effects, including neuropathy and pain and lymphedema. And so, obviously, talk to your doctor about what exercise you can handle, what sort of an exercise protocol makes sense for you. But even if it is just getting outside and walking, particularly when it's a glorious day like today, getting outside and walking, it's really, really good to include exercise as part of your coping mechanism. So with all of that nonsense going on in our bodies and in our brains, it can be really, really hard for people around you to know how to interact with you, and for you to know how to interact with those that you love, and even casual friends. And it's hard because throughout all of this, we're unsure about ourselves and our own emotions. Others around us are unsure about what we're going through physically, and not knowing how to talk with us about those emotions. And so we all tend to create a little bit of distance. We hold back a little bit in what we communicate. And sometimes, as the patient, we hold back because we're not sure we're ready to face those emotions yet, or face those facts. So we certainly don't want to put them out there for anybody else to understand. Sometimes we hold back because we're being protective of those around us. And sometimes we hold back just because, we can't handle it. We know that this is going on, but we don't have the energy to be in dialogue with other people about what our emotions are. And so we hold back a little bit. And if we're holding back a little bit, that means that those around us don't fully understand and appreciate what we're thinking and feeling as we're going through cancer. At the same time, a loving care partner may be as overwhelmed emotionally, though obviously not going through the same physical challenges, as we as patients are, because they're worried about, well, how do I keep the household running when she was the one who did X, Y, and Z, as we all do, as women know. And how do I help her feel good when I'm scared myself about what's going to happen to her? And how do I talk with her about this if she's not wanting to talk about it? And so, loving care partners begin to hold back. And of course, the more you hold back, the more there is a little gap between you, and that gap has the ability to grow and grow over time. And so relationships can really take a hit during a cancer experience, and it can be really hard to build back from that hit. And of course, our relationships can take a hit on an emotional level, but there's also a lot going on physically that can get in the way of intimacy on a physical level as well as an emotional level. So, in addition to all of this emotions, we've got dramatic body changes. Like me, you might have had a hysterectomy, and oh boy, did that ever change things. Or if you had a mastectomy or a lumpectomy, you've got scars that are sensitive. You've got dramatic hormonal changes. You've got body image issues as a result of these changes, you don't necessarily want to, you know, get naked under the covers with somebody, no matter how long you've loved them, given what you're feeling inside your skin. So in addition to those emotional wedges, we can create some physical wedges as a result of cancer, and all of those can be hard to build back from.
Cynthia, I have a question for you just about this very topic. And this is something that I hear sometimes comes up in just our conversations with our participants is maybe someone has held back. They're not quite ready to speak with others in their life or with friends or acquaintances, but maybe they get to a point where they are ready, but they're not really sure how to start that conversation, or they're afraid they're going to get over emotional, or they want to, they're ready to share a little bit. They're ready to sort of engage. Do you have any tips for sort of how to start that conversation, how to give that person that's ready to share a little bit of control so they kind of know what information they're putting out there, but they don't quite know how to start?
Yeah, it's a really good question. And I think that, the important thing is to be sure you understand what you're comfortable with, and to be able to describe to yourself those boundaries. Like, I can talk about the fact that I am feeling anxious and depressed, but I don't necessarily want to tell you that I'm crying every day in the shower. I can
Okay.
talk about um, how I don't feel good inside my skin, but I don't necessarily want to talk about sexual intimacy. So just have that conversation with yourself
Okay.
first. And then to the extent possible, you want to start the conversations in person, preferably being able to be in physical contact. So even if, it's a dear friend and you haven't been honest with that dear friend, and you sit down over a cup of coffee and you take your friend's hand and say, look, I haven't been able to be honest with you about all that I've been going through. I want to share a little bit, but know that, I've kept this from you because of me, not because of our relationship, so that you're letting people know that you didn't mean to create boundaries, but that those you didn't mean to push them away, but that you need to create some
Yeah.
boundaries around
Yeah, I think,
yourself.
yeah,
Um,
we hear that often. Boundaries are important, in so many different aspects of life. So I'm glad you brought that up, that, it is okay, and it is a good thing to set some boundaries for ourselves in regard to these tough emotional conversations, especially.
yeah, I think that boundaries are hard, and it really gets harder because there is this expectation that we stay strong, that we be positive throughout cancer. And so that makes it really hard for us to acknowledge that we have any negative emotions around our whole experience. And so, even if a friend who we've known for forever says, well, I'm here for you, whatever I can do to help you, we don't know that they understand what we're really going through. We don't know the degree to which they're willing to support us through, depression and fatigue and chaos and everything else that we're going through. And so we have to sort of tiptoe into it while protecting our own integrity. It's a baby steps conversation, and I recommend different conversations for different levels of relationship. My mom was 90 years old when I was diagnosed. I didn't want for her to be any more afraid of my cancer diagnosis than was absolutely necessary. And so I gave her only tiny bits of information until long after the fact. And in fact, it was only after she read my book that she said, oh, I didn't really appreciate all that you had been through. And I was like, of course you didn't, because I didn't tell you. So that was one of the boundaries I had to put up. My daughter had recently graduated from college and was home from school that year before going off to graduate school. And she was there through everything. But I didn't want to burden her with all of my emotions up front. And so it was only sort of after I was able to process what I was going through, that I was able to tell her a bit about what I was feeling earlier. So it's tricky because you don't fully understand what you're feeling when you're feeling it, and you don't know why you're feeling it. And you want support, but you also want to respect the relationships that have existed beforehand. All of which says that, it's really great to be able to talk to somebody who does fully understand, whether that be in a supportive environment like this, or with a one-on-one psychotherapist, or whatever is right for you given your need, because everyone deserves to have somebody in their back corner who really fully understands what they're going through.
Yeah, I love that. And we have a really wonderful comment in the chat. And one of the first words that stuck out at me about what Anne Marie wrote was validating. It is so validating, because you're right. And I know when you and I connected before, we love just hearing that, yes, every emotion that a person feels in all of their experiences are valid, and it's okay to feel that whole. I love that you called it that roller coaster of emotions, because that's exactly what it is. It's okay to feel all of them.
It is, and I think it's hard in our society because we're beginning to open up around mental health, but we're not conversant in mental health. We don't talk about what's going on with our emotions. It's just not part of what society does, and we don't talk about cancer. And if we don't talk about cancer, we don't talk about mental health. How are we going to talk about the intersection? And we don't. And then our healthcare system is so fragmented. And that's great, because that means we have specialists in each and every type of cancer. But it also means that we don't have oncologists who are also psycho-oncologists. So the psycho-oncology piece tends to be somebody else. And so our doctors are really good about, okay, what's going on physically? How are you responding to this chemo? What do your numbers look like? How does your body feel? How can I help you with, your nausea, or your fatigue, or your neuropathy? But they're not so good about asking, how are you doing emotionally? How are you carrying the burden of this disease? Are you well supported at home? Do you have somebody that you can talk to? And if not, here is a great support group, or here is a hospital resource you can talk to. Here is a psycho-oncologist. Here is a palliative care specialist who can prescribe medications for you to help you cope with some of these emotional turmoils. So there are tremendous resources out there, but because we don't talk about mental health, we don't talk about the mental health aspects of cancer, and therefore we as patients don't know that it is okay to feel these things, or that it is okay to ask for help in dealing with them. That infuriates me, and is why I like to talk about this as much as possible, because I think that we are all struggling and grasping at straws, when in fact there are so many great support mechanisms out there for us all.
Yeah, I love that. I love that you mentioned, right, like when at a diagnosis, that the mental, your physician may say you might experience this. Here are some of these common side effects, but you're right. They don't often go into, but you may also experience these type of changes, or you might start feeling this way. I love that you called that out. And, we love our medical teams. They are wonderful at what they do. That's why also at Unite for Her, we have seen such an uptick in our participants reaching out to speak with counselors that are trained in working with oncology populations, because they understand the specifics of what comes along with, like you said, different types of treatments, steroids, shifts in hormones, and having a trusted person that can that that they can reach out to, that understands, that is familiar with all of this. And even what Lisa said in the chat, appreciating hearing this from someone that's gone through it. We appreciate that, but also that these still happen 5 years post-treatment.
Yeah. These things continue to happen. It takes a while. If all goes well and treatment ends, it's usually about 18 months before the body has physically recovered from surgery, chemo, radiation, immunotherapy. All of those things, they're nasty. Immunotherapy is better in a lot of ways than the blunt instrument that chemotherapy is, but it still has some really nasty side effects. So you have to give yourself 18 months to recover physically. And it's only after you've recovered physically that you can then process all of those emotions. And so, yeah, it can take a while. It really can take a while. So it's best that we give ourselves the time to do that. And I think that's, again, the toxic positivity and the burdens placed on us by society about how we're supposed to perform through cancer. One of the expectations really is that well, okay, you're done, get over it. I was like, no, that doesn't happen. And so we need to give ourselves the grace, even if others around us are not giving us the grace, to take the time we need to recover. And if that's 6 months, 12 months, 3 years after physical recovery, that's what it takes. And that's your experience. That's your reality. And that's legitimate. That is appropriate for you.
I love that. And if anyone, as I said, we welcome questions in the chat. If anyone has some of the mind body or just some of the mind or movement outlets that Cynthia has mentioned, if anything has worked for anyone here, we would love to hear sort of what helped you, what has been the thing that's worked. I love that you mentioned, Cynthia, not everything works for everyone, and every day things may change.
Yeah.
I remember chatting with one of our participants. She heard so much goodness about journaling, right? Love journaling. Everybody was doing journaling. And she started and she found that it was not for her. It was not. She said it actually did more harm than good. It was not a therapeutic outlet. So just kind of learning that there are these different things out there to try, but we have to find what works for us.
One of the things I uncovered as I was doing research for the book was a concept I think it's from Japan, called forest bathing. And the idea is that you got out into the woods, any woods, and there are chemicals, volatile chemicals being released from the trees that, we might smell them, but we might not smell them at all. But those chemicals actually help to change our brain chemistry. And again, just reduce the stress hormones. And so just, 20 minutes of sitting in the woods. My daughter used to run away to the woods when she was angry. And now I understand why, because just sitting in the woods for 20 minutes will just calm your emotions. So it's forest bathing. Add that to your quiver of coping arrows.
I love that. Mother Nature is so healing. I love that.
It really can be. It really can be.
Yep. Wonderful. Well, certainly if anyone has any questions for Cynthia, please feel free to put them in the chat. You're welcome to come off of mute. We have a small group here. We would love to hear from you. You're absolutely welcome to share. I just popped her link to the website in the chat. So if you want to check that out also, please feel free to do so.
Another thing I like to remind patients is that, our doctors are experts, and they are great experts, but they are experts in cancer. You as the patient are the only expert in you. You are the only one who knows what it feels like to be inside your skin, to be experiencing the particular cancer, the particular treatment, the particular response to that treatment that you're having. So I always advise the patients that I mentor to go into each conversation with their doctors as a dialogue between experts, because it's your expertise and the doctor's expertise that are going to help you find your way through this And really, the doctor has no way of knowing what you're experiencing. You have no way of, becoming an oncologist overnight, but you are certainly an expert in what's going on in your body, in your world, in your life. So please advocate for yourself.
Mm. Yeah, Teresa's comment, I found that the doctors don't tell you how you will feel after the treatment is over, and they don't tell you all the little things that you experience. Yeah.
Yeah, it is so true.
Mhm.
It is so true. And I think that sense of loss and bewilderment is just so common. I mean, one patient I interviewed said she really felt like, I don't know, you folks may be too young for the movie Born Free, where there's this lion who was in captivity for a long time and then eventually gets set free back into the wilds of Africa. And she's never been free. She doesn't know from the wilderness around her. She has some instincts about how to get on, but this patient said that's what she felt like. It was like she was being set loose in the wilderness again, and needing to figure out for herself, how to get on with her life. And we all really struggle with, well, what does it mean to be done with treatment? What does it mean that I survived that ordeal, and what's the next ordeal? So it's a very tricky time.
Yeah. Lisa says, yeah, when she talks with wellness participants, she often suggests they try counseling and massage. Both are good ways to release the tension. They may not realize they're carrying. And I love that. I may not realize they're carrying, because I think, even parlaying that into our emotional, we may not realize we are having anxiety that's keeping us up at night, or we are having a lot of stress that is adding to the fatigue. I think that that's also something to call out, that I guess if these are new emotions that maybe a person isn't accustomed to feeling because of past life experiences, they may not recognize them.
Yeah, I think that's absolutely right. And in fact, the physical process of releasing muscle tension through a massage actually changes brain chemistry. And so again, it's not just that it feels good, but it actually does good for the brain and for emotions. So it's treating yourself, but it's also healing yourself to have a massage. We think of a massage as something that is a special occasion thing, as opposed to something that is a part of our healthcare. But it really is a part of, or should be a part of our healthcare. If we can find somebody to massage our feet or give us a back rub. It doesn't have to be a formal massage. Doesn't have to be one we pay for. It can really make a huge difference.
I think anymore we are learning how closely related our mind and our body is in every aspect, and just like you said, we see that in something like massage, the real brain benefits and stress relief that we get from it. And Cynthia mentioned something, therapy is great. It allowed me to release all my anger and express my feelings, and just having someone that you trust so you can be open and vulnerable in sharing those feelings.
Yeah. And anger is such a common part of this, that we often feel like we don't have a chance, a right to express. Of course, we should be angry. Why did it happen to us? And in fact, 40% of us get cancer at some point in our lives. So, the why me can also be thought of as why not me, but it is very angering that that it happens to us, and when it happens and why it happens, and we don't have control over that. There is a lot of understanding that there are things that happen that increase the likelihood of cancer. Everything from our own cigarette smoking to environmental pollution increases the likelihood of cancer. But that doesn't mean that everybody who smokes gets cancer. We all know lots of people that smoke 3 packs a day and never got sick. So why is it that I, who never smoked, should get cancer? So those questions remain, and that contributes to our anger, because we like to think that we have some control over our lives. And I think one of the things that cancer makes perfectly clear is that we have no control. But who's going to get cancer? Who's going to respond well to treatment? These things are beyond our control, and sometimes just being able to let go of that can be really, really hard, but can be really beneficial. So I don't know. Some of us are more control freaks than others, and I think I put myself in that category of thinking that I have control over everything. But in fact,
Yeah. We did have a question, and maybe you have some good tips, Cynthia. I'm also going to link our provider list, but Heather just had a question, how did anyone who sought therapy go about finding the right therapist? I think that is a wonderful question. Yes, we have a wonderful provider list, but even we say, our providers are vetted, they're trusted, but you got to find the right person that you connect with, right? It's all about that connection. Any suggestions for those that might be seeking out that right therapist, that, any tips that you might have?
Yeah, well, two thoughts on that. One is, in addition to the resources on your website, there's another organization called cancercare.org, which also has a tremendous number of social workers and psychotherapists, and available for free. I think that the important thing is to think about it as a match. That just because you have a first conversation with somebody doesn't mean that that's somebody you're going to be able to warm up to and feel comfortable both expressing your anger and your fears and your your secrets to. So it makes sense to have a conversation with a couple of people to try them out. You wouldn't buy a pair of shoes without trying them on, although now we all do. We have them shipped to the home and then try them on, but you can return those. And the same thing with a psychotherapist. You really want to try them on and make sure that it feels like a good fit, that you feel comfortable, and that you will want to share. Some people just aren't going to be the right match for you, and therefore it's not going to go anywhere.
Yeah, that's wonderful. Yeah, sometimes it's not, like you said, not the first person, not the second person, but everyone has different styles. So yeah, you want to find. I love that it's like a match, right? We want to match with that. I love that analogy. Wonderful. Well, if anyone has any other questions for Cynthia, we are just about wrapping up, so you're welcome to put them in the chat. But again, I did link the website. Her website, thebigordeal.com. She has a wonderful book, wonderful resources, good for not only patients, but like we said, caregivers as well, to kind of get, I don't want to say comfortable with talking about these emotions, but just understanding them and how to conversate about them, because that is really important in anyone's health journey, is addressing that. So hopefully you check that out. Cynthia, thank you so much for being here with us. It has truly been, I'll pop on the screen with you. It has truly been wonderful hour of information and sharing. I know that so many of our attendees just appreciate the conversation and, like we said, the validation.
Well, I hope I have provided a little bit of information, but mostly I hope I have been able to validate and get everybody a little more comfortable that it's okay to have those conversations. It's okay to feel those emotions, and it's okay to ask for help with them. So
I love that. Oh, thank you. Yeah, lots of thanks in the chat.
Great.
Very validating in how they're feeling. Wonderful.
Good. Terrific.
Thank you.
All right. Well, good luck all, and feel free to connect via my website, send me email. Always happy to answer questions. So
wonderful. And you're on social media, correct?
I am. You can find me on Facebook and Twitter. Twitter, it's just the big ordeal, and Facebook and Instagram, it is cancer.thebigordeal.
Wonderful. We will definitely be connecting. So thank you so much.
All right. Thank you. Have a good night.
You're welcome.
Bye-bye.
You too. So I want to give a big thanks again to Cynthia for joining, and thank you to everyone that hopped on for our virtual hangout this evening. One quick reminder, we are doing a special virtual hangout again next week. So normally we do these once a month at the beginning, but next week, speaking of our emotions, Sarah Murphy, who is our Unite for Her counselor, she and I will be having some potty talk next Wednesday. But what we will be talking about, we'll be addressing specifically the GI side effects that come along with treatment, medications. I'll be talking about the nutrition aspect of that and how foods can help, how we can look at foods and ingredients to help manage some of those side effects. Sarah will be talking about that gut-brain relationship and how our stress and anxiety affects those GI side effects. And she'll be going through also some techniques that we can do when we're having tough emotions, when we are having those side effects. So lots of learning. That will be next Wednesday, November 9th, same time, 5 p.m. Eastern time. We will be recording it, so know that if you're busy, you're not able to join us, it will be in our library again. Also want to give one final big thanks to our sponsors this evening, West Pharmaceutical, and then our supporting sponsors, Daiichi-Sanyko, Merck, and Seagen, for continuing to support our education outreach. Be on the lookout on our social media for all different events and speakers that we have going on this month and through the end of the year. And with that, this concludes our virtual hangout. Thank you so much for joining us this evening. Again, special thanks to our expert, Cynthia Hayes, for joining us. And hopefully we will see you again soon. Everyone have a wonderful evening. Stay safe